If you're considering starting a ketogenic diet, please don't do it until you watch this video. This is especially true if you're using it to treat a serious psychiatric condition or if you take psychiatric medications. The ketogenic diet, or therapeutic nutritional ketosis, is a powerful medical intervention that needs to be done safely. It's also potentially incredibly effective for improving symptoms of mental illness, as well as improving type 2 diabetes, hypertension, and other metabolic abnormalities, which have been shown in multiple studies. But first, welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Brett Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan, after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention called nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope. Freedom from the burden of mental illness is possible. In this video, we'll explain the main reasons you may need to be careful when starting with therapeutic nutritional ketosis, including advice on how to speak to your physician when starting nutritional ketosis. So make sure you watch through to the end to get all that information. But the main points are, first, make sure you're doing this with professional help. And second, this is not about stopping your medications. Now, it may be possible to decrease or eventually stop some medications in the future, but typically that's not done for many months and only with the close support of your prescribing physician. Instead, committing to staying on your medications and working with your physician is crucial. Now, therapeutic nutritional ketosis, or simply starting a ketogenic diet, is a powerful health and medical intervention that can change your body's metabolism and can dramatically alter brain function, medications levels, sleep patterns, energy levels, and other physiologic functions. If you have a psychiatric diagnosis or symptoms or take psychiatric medications, you should not start a ketogenic diet alone. Instead, you should only consider starting therapeutic ketogenic intervention with careful monitoring from your healthcare provider or an experienced clinician. We hope you'll learn from our information and take that information to your healthcare provider to discuss whether therapeutic ketosis is an appropriate, safe, and potentially effective intervention for you. So let's get to these 4 main concerns when starting a ketogenic diet, especially for those with mental illness. First, you can actually feel worse before you feel better. Second, it can change medications levels or even side effects from your medications. Third, it can significantly affect your sleep. And fourth, it can either increase or decrease your energy level, which can contribute to psychiatric symptoms. But before even getting into all that, let's hear from Harvard psychiatrist, metabolic psychiatry pioneer, and author of the book Brain Energy, Dr. Chris Palmer, on why he thinks it's so important to work with a trained clinician when starting therapeutic ketosis with serious mental illnesses like severe depression, bipolar disorder, or schizophrenia.
So the first one that I'm going to say is that people with those disorders have serious mental disorders. That's kind of what they're called. Serious mental illnesses. Why are they called that? Because they're serious. And what makes them serious, they often disable people, but almost more importantly, they sometimes come with dangerous or life-threatening symptoms like suicidality or agitation. So the first recommendation that I make is that if you have a serious mental illness, I really want you to do this treatment with a medical professional. I don't want you to try to treat your mental disorder on your own. Why? Because it's a serious disorder and you deserve competent, qualified care. And you deserve somebody to get you through the treatment and manage the treatment in a safe and effective way. And safety and effectiveness are both really important. I think one of the biggest risks in starting the intervention is that during the keto adaptation phase, some patients can actually get worse before they get better. And what that means is that their depression might get worse, insomnia can develop, and that can lead to precipitating a manic or hypomanic episode. Some patients can get even more psychotic before the treatment starts to reduce their psychotic symptoms. It's important to understand the science of why and how that happens. I think once clinicians and patients understand that science, they'll understand that this is something that is still worthwhile to try and to get through, but it needs to be done in a safe way. And it needs to be managed in a medically supervised way. But what I'm here to tell everyone is I don't want the takeaway from that to be the ketogenic diet is a dangerous treatment. I want people to take away these disorders are dangerous disorders. The ketogenic diet is a very powerful treatment. And when you combine a powerful treatment with a dangerous disorder, you can sometimes have dangerous situations. But the ketogenic diet can transform people's lives. So although there are risks, and although I am encouraging people to get medical supervision for it, by no means am I trying to dissuade people from trying it, because I think a lot of people, it is the best option for them. And I think I've seen a lot of people completely transform their lives, go into full remission, sometimes off medications. And that just is not possible with standard treatments right now.
That's such a great way to sum it up. You're combining a powerful medical treatment with a dangerous disorder, and you should not do that on your own. As he said, you deserve professional care. You deserve to ensure you're starting a safe and effective intervention. And according to Harvard-trained psychiatrist and nutritional psychiatry pioneer, Dr. Georgia Ede, it all starts with a thorough medical history. Now, if you know Georgia, this answer comes as no surprise. Dr. Ede is a very thoughtful and very thorough clinician and the leading clinician educator in metabolic psychiatry. So when she talks, I take note.
The most important thing is that to pay close attention to medications, to existing health conditions, and to risk history. If a person is going to their clinician to ask to try a ketogenic diet for a mental health condition, it's really important to share mental health history with particular attention to any higher risk symptoms that they may have struggled with, so such as suicidal thoughts or self-injury or aggression, eating disorder behaviors, so that your clinical team can work with you to create a safe transition plan as well as a backup plan in case the diet isn't working or makes you feel worse. There are some cases where when you're first transitioning to a ketogenic diet, you may feel worse before you feel better. And it's not true for most people, and it usually resolves within a few weeks, but your safety has to be, of course, of the utmost importance. And so it's really important to let your providers know about all of these pieces so that they can pay attention to all of them as they're working with you. I would emphasize that this is a very, in the vast majority of people, a very safe, well-tolerated intervention. It's simply that the transition as the body is reaching its new equilibrium, as you're shifting the primary source of your energy from glucose to fat. When you're doing that, there are a lot of changes that happen in the body, and these are really positive changes and really healthy changes. It's just that as that's happening, it can be uncomfortable, particularly if you start the diet too quickly, too abruptly, and if you're not paying attention to all of these moving pieces. And so one of the things that I help clinicians understand in the training program is that you can't just launch into a ketogenic diet without taking a really good history and making a very thoughtful treatment plan beforehand.
So here's the first reason why clinicians warn you may want to be very cautious when starting a ketogenic diet. You can actually feel worse when you start. See, your body transitions from burning glucose for energy to burning fat and ketones. And this transition is frequently called the keto flu, but could also be called carbohydrate withdrawal or simply a keto transition. This transition can last a few days to up to 2 weeks, and many people could feel headaches, decreased energy, nausea, dizziness, and achiness. You can see why it's called the keto flu. It almost sounds like I'm describing symptoms of influenza. Now, Beth Zupec, Kania, a dietitian with over 30 years of experience with keto diets, explains her tips for avoiding or managing the keto flu.
It's interesting to me that I worked with keto flu for a long time and never knew that was a good terminology for it. We just called it a adverse effect of going into ketosis. And I think keto flu really makes it sound more real, and it's just a more of a pedestrian term. But keto flu can happen. It is very, very avoidable to mitigate these symptoms of keto flu by taking some steps. And I worked on a little media piece with a dietitian from UCLA to get this point across to people. And the Charlie Foundation actually distributes this, and I'd be happy to provide a copy to you of it. But keto flu actually is related to dehydration and loss of electrolytes from when you go into ketosis. So it can happen very suddenly if you're starting this diet all at once. And it's less likely to happen if you gradually move into ketosis, which is what I usually do with my clients because they're so far away from me and I want to do this safely. So hydration and some electrolytes in terms of, maybe just adding salt to your foods or getting some potassium-rich foods while you're going into ketosis are some simple things that can be done. The real damage in going into a severe keto flu is you can kind of crash and get admitted to the emergency room for fluids, which isn't fun for anyone and totally avoidable. And B, it may discourage you from moving forward because people can feel lousy for a couple weeks. I've worked with people like that who just feel really lousy and then they feel great afterwards, but not everyone can get through 2 weeks of that. You got to be pretty motivated to survive that. But again, it's pretty avoidable if you take some prevention steps.
As you heard, the good news is you can treat keto flu and diminish or maybe even eliminate the symptoms by being very aggressive with your hydration. Lots and lots of fluids. Also, adding electrolytes like magnesium, potassium, and sodium can be very helpful. Now, you have to be cautious if you have high blood pressure or kidney disease, so definitely work with your physician if that's the case. But some hacks people like to use are drinking bone broth or even sipping on pickle juice. Although I want to emphasize the word sipping. I have to admit, I tried drinking pickle juice and that was a pretty unpleasant experience, but sipping on it is much better. I promise. And of course, you can salt your food. Some people even drink bouillon cubes. The key is increasing hydration and electrolytes, which can help with this transition period. But here's another trick. As Beth mentioned, the speed of starting a ketogenic diet can impact whether someone experiences keto flu symptoms. So let's hear again from Dr. Georgia Eid about whether she prefers people doing so-called cold turkey straight into a keto diet, or if she prefers people starting a little slower.
I really I've gradually learned over time that it is, for most people, much more comfortable and much more practical to go a little bit more slowly for a lot of different reasons, but particularly when people are taking certain medications that affect, say, for example, blood pressure or blood sugar. Blood pressure and blood sugar can change very quickly in the very first few days of a ketogenic diet in particular. If you have an existing health problem, and if you take certain types of medications, plunging yourself in from let's say a standard diet with hundreds of grams of refined carbohydrate in it to a squeaky clean ketogenic diet, that's a huge shock physiologically to the brain and to the body. You'll put yourself through unnecessary misery if you do that. What's the hurry? If you go a little bit more slowly, it'll be a lot more comfortable. Now, there are some people who want to do it more quickly, and for some people, there's no reason why they can't. But I think if I don't know you, my recommendation would be to say ease into it. You want to set yourself up for success. You want to be able to experience what's on the other side, what's waiting for you on the other side. And if you don't get there, you're not going to be able to experience all of the wonderful things that are possible. Why not ease yourself in and practice simpler strategies first, and over a course of several weeks, work your way towards ketosis.
Now, I think another point that George's quote brings up is the importance of working with someone who knows you. Someone who knows if you're better off starting slowly and working with simple strategies, like maybe first avoiding sugar and soda for 2 weeks, and then maybe transitioning to no grains for 2 weeks or something like that. There are many different ways to approach this, but the key is finding out what will work best for you with your lifestyle, with your personality, with your likes and dislikes. But for instance, others may have a personality more suited to just jumping in and going right at it and eating less than 20 grams of carbs right away. But as Dr. Eid mentioned, that's when you're more likely to get symptoms of the keto flu, and you're less likely to get those symptoms if you ease into it. So you have to know what's the best approach for you. Now, the second reason to be very cautious when starting nutritional ketosis with mental illness is how it can affect your medications. This includes blood sugar and blood pressure medications as well, but also psychiatric medications. As we mentioned, nutritional ketosis is a powerful physiologic intervention, and it changes your metabolism and is a medical intervention. And that intervention can change the levels of the medications in your body, in your bloodstream. That's why it's so important to work with your doctor to monitor you for symptoms or side effects and to monitor you with regular blood tests. Let's hear what the main medications of concern are from Dr. Eid.
Yeah, so in addition to what I think a lot of people are already aware of from the clinical and research work in diabetes and obesity, for example, is of course you have to pay attention to any medication that affects blood sugar. And any medication that affects blood pressure. Those are right up at the top of the list. But then when it comes to the psychiatric medications, now I want to first say that everything I'm saying here, this is not a complete list, but the top medications, as you asked, the most important ones to pay attention to among the psychiatric medications are the anticonvulsants and lithium. Their blood levels can change early on in the diet, and so you need to pay close attention to those. But the other really interesting thing that I've noticed as I've worked with so many people is that even when the blood levels of a medication don't change, how you feel on that medication can change. And so I teach clinicians, don't just treat the blood test, treat the patient. Pay attention to how that person's feeling, because sometimes as you're going along, a medication can start to feel too strong. You might notice side effects of that medication that weren't present before you started the diet. And feeling your way through that with a patient takes some experience. You want people who are taking medications to also be able to try this diet, not just people who aren't. It is definitely easier if you're not taking medications. There's no question about it. But so many people who are taking medications do benefit from this diet. So don't let that stand in the way.
Okay, now let's get to the third reason for caution when treating mental illness with nutritional ketosis. Sleep. Sleep is so important. And when some people start a ketogenic diet, they may find they sleep less. This can present as either trouble falling asleep or staying asleep, or simply feeling like they need less sleep. Now, as Dr. Palmer mentioned in his previous clip, if someone is prone to mania or psychosis, a decrease in their amount of sleep could trigger a very dangerous situation. And again, that's why working with a trained clinician is so important. Oftentimes, a clinician may increase anti-mania or antipsychotic medications in the beginning, or they may prescribe an as-needed sleeping medication because it's so important to maintain adequate sleep rhythms and protect against mania or psychosis. But this is not something you should do on your own. Don't change your medication doses or start taking new medications. Sleep is one of the most important things to monitor when starting a ketogenic diet and to work closely with your clinician. And now the number 4 reason for caution when treating mental illness with nutritional ketosis is that your energy levels can change. And what's interesting is some people can experience increased energy and some can experience decreased energy. For instance, if you're going through the Keto Flu transition, most people will experience some degree of decreased energy, which could make symptoms of severe depression worse. Although others can have increased energy, which could trigger hypomania or even mania, so making it very important to monitor. And here's another great point about monitoring. As important as it is working with your clinician and your healthcare practitioner, it's equally important to work with your friends and your family. Your friends and your family are the ones who see you on a daily basis and who can be objective voices about how things are changing. Interestingly, you may not notice yourself that you're not sleeping as much or you have decreased energy, or even if you're becoming a little hypomanic, but often friends and families may notice well before you do. So one important recommendation from experts in this field is to let your friends and family know what you're doing and have them watch this video maybe even so they know what to be on the lookout for. You can help educate your friends and your family so they can be an important part of your team. So let's hear from Dr. Palmer again about why he thinks it's so important to recruit family and friends as part of your support system.
Absolutely. And, even if you're just somebody who's trying the ketogenic diet for mild depression or anxiety and you're trying to do it without medical supervision, it's great to have family support anyway. Because guess what? Family members or friends or roommates or whoever you live with are going to have junk food that tempts you, or they're going to be eating in front of you or offering you food. So it's important that people you live with, people that you go out to dinner with, understand that you're trying this treatment, that they respect that, hopefully that they support it, and ideally maybe that they even try to do some of it with you. Maybe if they don't need a ketogenic diet, it's fine. They don't need to do that, but maybe they sit with you, have meals that are more consistent with it, or avoid eating the foods that are really going to tempt you, especially in the first month or two. Avoid eating those foods in front of you, out of respect and compassion. But there's no doubt that family members always play a role in the treatment of serious mental disorders, whether you're using the ketogenic diet or a medication or a psychotherapy or electroconvulsive therapy. Family members are essential to helping people recover from serious mental illness, and they absolutely need to play a role in this intervention as well.
All right, so now you may remember earlier in the video, I promised to tell you how to talk to your physician about all this. But before we get into that, here's a quick review. So when starting therapeutic nutritional ketosis, it's important to do it with professional help because First, you may feel worse before you feel better. Secondly, it can alter your medication levels or side effects that you experience from medications. Third, it can significantly alter your sleep, which may make you more prone to mania or psychosis. And fourth, you may experience either increased or decreased energy. So it's clear it's essential to work with your family, your friends, and your clinicians and not start this intervention alone. This is a powerful medical intervention for a dangerous medical conditions, as Dr. Palmer said, and you deserve to be treating it as such. Now, if you're working with a psychiatrist or other physician who's aware of therapeutic nutritional ketosis or has taken Dr. Ead's training course and is on board with all this, it's much more manageable to start, right? You should have no problem discussing this with your clinician, but we have to be honest, unfortunately, most people may not have that benefit, at least not yet. And we hope to try and help change that along with many others in this field. So what can you do if your doctor isn't aware of how to help someone start nutritional ketosis or how to treat mental illness with ketosis? I would say the first thing is to share this video with them and share resources like Dr. Ead's training course or her PDF that we have linked in our description. You can be a big part of your clinician's education. And this is such an important topic. We're going to dedicate a couple of videos specifically to this topic to go into it in much more detail. But here's what I think is the most crucial takeaway point. Work with your clinician as a team. It sounds simple, but it's just like any form of communication, right? Whether it's with your spouse or your friends or your boss, being cordial and trying to work in a collaborative teamwork manner is far more successful than being confrontational. Remember, your psychiatrist has dedicated their professional career to treating mental illness. So it's probably not a welcome sight for someone to come in claiming they know more than the psychiatrist because they've watched a few YouTube videos. That's how confrontational communication starts, but a collaborative, team-based approach is likely much more effective. You can say what you want about the medical system, right? Insurance payments and a system that tolerates 5-minute doctor visits and so on. That's what's wrong with medicine, but I still believe that at their core, most doctors want to help. Most physicians became physicians to help people, especially psychiatrists who want to help people with mental illness. So I suggest starting by giving the benefit of the doubt, right? Explain what you want to do, why you want to try it, and that you need your physician's help to do it safely and that you're hoping they can work with you as part of their team to ensure a safe transition to therapeutic nutritional ketosis. And like I said, you can share this video with them and watch our next videos and share those with them as well as we go into even more detail about communicating with your healthcare practitioners about starting therapeutic nutritional ketosis for treating serious mental illness. And we'll provide even more resources for you and your clinicians in those next videos. And as always, if you found this video helpful, please click the thumbs up and subscribe buttons and share this video with your family, your friends, and your healthcare providers so you can help us spread our message to as many people as possible. And as always, please leave a comment. We'd love to interact with you and hear what you found most helpful. Thank you so much for watching. Take care of yourself, take care of others, and we'll see you here next time at Metabolic Mind.